I like this guy, Dr. Dean. I'm Dr. Dean Waldman, if you want to say the whole thing. Hi, Dr. Dean. How are you?
I'm wonderful. Thank you.
Great. So I asked Dr. Dean, should I say Dr. Waldman or Dr. Dean? And then he tells me, for 40 years, you've been with them little there kids, right? The pediatrics. And they like to call you Dr. How did you say that?
Dr. Dean, Dr. Dean.
You're perfect for a pediatric doctor. But we're going to talk about actually quite serious issues in addition to children, who are the most serious issue, because that's our future by far. But you wrote a book, Curing the Cancer in the United States, Healthcare, StatesCare and Market-Based Medicine. And Dr. Dean is chief of pediatric cardiology at the Children's Hospital of San Diego. And he's worked at the University of Chicago and New Mexico. He's, I believe, went to Yale. I saw here something. He's been a busy guy. And I believe we can talk about cancer or about government healthcare, which is of interest as well. But I think he also has some additional thoughts just about how to live longer and how to deal with like autism and how to deal with other kinds of issues in our life, and maybe curative ways about going about that. So welcome to the show. How are you?
I'm great, thank you, and I'm happy to be here.
So tell us about why you wrote this book right now.
That's a mildly long explanation, but a very important one. I really love taking care of babies. My babies are the sickest ones because they have heart disease, but I really enjoy doing that, just the way many other nurses and doctors enjoy taking care of their patients, whether old people or young people or babies or, women, children, men, doesn't matter. They like doing that. And yet most of us are frustrated, angry, and I began to wonder, why is that so? And I did a bunch of research back in 2003, 2005, 2006. And what I found was something interesting. We love our job content, namely taking care of patients, and we hate, and that's not too strong a word, the job environment in which we are forced to do it. We are constantly being harassed, obstructed. People who don't have medical degrees are telling us what we can and cannot do for our patients. And it's a very frustrating experience to work within this system. So I said, well, okay, I now at least know what the major symptom is of all of our millions of healthcare workers. What's the root cause? What is causing this frustration, this anger, this early retirement, the doctor shortage, et cetera? And so I used my MBA knowledge and experience and so forth to analyze healthcare as a sick system. And what I found was this system, we call healthcare, actually has cancer. And the cancer is the federal bureaucracy. And the solution, the cure for the patient healthcare, is to get rid of that bureaucracy. And so this book is written for the average American, because let's face it, politicians, I don't care, Republican, Democrat, politicians in Washington don't want readily to give up power or control over 1/6 of our economy. But that's literally what I'm saying. I'm saying we, the patients, need to take back control of our lives, our money, and our happiness, and quite frankly, our futures. And so that's why I wrote this book. For the average American, I want just the guy on the street, the woman with a shopping cart, to read this and arm themselves with the truth of what the hell is going on.
Well, let me ask you a naive maybe question, because I don't think I really do know the answer. I have insurance. Okay, they call it insurance. Let's say this is pre-Medicare. Okay, but let's just say I have insurance, and does the and maybe I know the answer, but I'm not sure. You tell me. Does the federal government tell all these U.S. Healthcare, Aetna, all these nationwide, all these insurance, Geico, all the insurance companies, do they tell the insurance companies what they can do and what they can't do? Is that the way our country is structured?
Number one, that's true of 75 or 76 million Americans on Medicaid. For you in a private insurance environment, 180 million or so Americans, the insurance company and their intermediaries are doing that. So whether it's a government bureaucrat or an insurance bureaucrat, and I'll give you a great example in 1 second, they're telling your doctor what that doctor can and cannot do for you. Drugs. You know that if I want to order a drug for, you're a little old for
But
me.
don't use any names of companies, okay, please?
What?
Don't use like an insurance company's name.
No,
Okay.
this is every insurance company. Every insurance company
It cleared that up
uses,
easy.
uses a thing called a pharmacy benefit manager, which is a company that is a middleman for between the manufacturers, the pharmacists, and the health plans. It's an intermediary. And for me to write a prescription for a drug, I have to go to a computer, only government approved computer. I have to go to a computer and access the program for that pharmacy benefit management program. No matter what I think is right for that particular patient, when I put in a diagnosis, the program says, Dr. Waldman, you can use this drug as the first line. Well, wait a minute. That's not the drug that's best for this patient. That's the only drug you can use. Well, excuse me. I'm sorry. That's not the right drug for the patient. Answer, we don't care. Our program is set up to find the cheapest drug with the least side effects rather than the most effective drug for any patient. So, long-winded answer to say, yes, all these bureaucrats, whether insurance or government, are practicing medicine on Americans and telling your doctor what he or she can or cannot do. And by the way, you started something that I really need to answer right now, which is you have insurance. God willing, you have insurance. Fine. The average American family in 2019 spent $28,166 on healthcare. Okay? 83% of that went to an insurance company. Now, I say, well, wait a minute. Why are we paying the insurance companies the vast majority of our dollars? Why don't we pay the doctors and have control of our own money and go shop and pay for the doctors and simply have catastrophic insurance if the you-know-what hits the fan? But otherwise, with $28,000 every year, I can pay for a hernia repair, because in the private world, without the government bureaucracy, the cost of a hernia repair is like $1,500 or $2,000. With insurance, it's $15,000. So I turn around and say, hey, people need to retake control of their lives, their money, and their health care. And the book, Curing the Cancer in U.S. Healthcare, says this is how you do it.
So I'll just ask you for a couple hints here. How do you do it?
Sure. Sorry?
How do you do it?
How do you do it?
I read the book, but in a little synopsis here.
Okay, how do you do it?
I mean, how do you organize?
We know that. Oh, well, firstly, we the people. I like to call us we the patients, because the fact is, Republican, Democrat, black, white, green, I don't care. Everybody needs healthcare sooner or later, and so that's a common need that we all have, and we should decide that. So, how do we do it? We have to get the federal government out of healthcare. How does that happen? By the way, when we do that, another thing I need to point out, almost half of all US healthcare spending produces no care. It does not go to a doctor, a pharmacist, a hospital, a wheelchair manufacturer, a nurse, nobody. $1.4 trillion last year went to the bureaucracy, and I want those dollars either to go back into Americans' pockets or to pay for more timely care, pay for more doctors and more care and more drugs and more whatever. Either way, we shouldn't be paying over $1 trillion to the federal bureaucracy to, quote, run our healthcare when we can run it just fine by ourselves, we the people. So answer to your question, how do we do it? We have to get Washington out of healthcare, and they're not going to want to do that. We need to lobby our state representatives to say, hey, we want to control our healthcare. We, the state of Wyoming or Connecticut or New York or wherever you are, we want to control our healthcare, and we don't want to waste $1 trillion of healthcare spending on the federal bureaucracy.
Whew. All right. Well, this is a serious scenario that I am not aware of. And
well, let me say this right now, and I shouldn't say this attacking myself, but I'm going to be perfectly honest. A number of people that I respect highly, who respect me, have said, you know, that's the right answer, and it can't be done. It is impossible, and I have to say I reject that conclusion, because if you accept that we can't do this for our own benefit, then what you've done is a self-fulfilling prophecy. You've created a situation where you cannot fix healthcare.
now, isn't there, I don't know, maybe either you'll say a name or two or maybe not, but isn't there any other, you know, you got, if I understood you right, you had the government, but that's the Medicare, Medicaid story, it seems to me. And then you have the insurance companies, everybody else under 65, I guess. Or when the state has, you know, the state kind of things.
StatesCare, go on.
Obamacare, is Obamacare, that type of thing, is that federal government? Is that like Medicare?
No, yes, it is. There is no plan except mine called StatesCare. There is no plan anywhere that doesn't start with the federal government controlling healthcare. So whether it's a single payer in Great Britain or our own Veterans Administration, which is a single payer and a disaster for our veterans, it makes me crazy what we do and don't do for them and to them. Every plan that you can name except StatesCare starts with control in the Beltway.
So are there organizations that are trying to repair what you see as a broken system?
Yes, and the only one.
Is there something called AARP? I don't know. Is there somebody out there that's?
Yes, there is one person. What is this? Go away. Oops. Are you there?
I'm here.
Go away. I don't know why this thing went off. I can't see you. Can you see me?
I can't see you.
Okay. I don't know what's going on here. Anyway, but I can still talk, which is, and as long as you can see me, that's okay. There is an organization, the AMA is an organization that has for years been primarily focused on its own authority and not on the welfare of patients or the welfare of doctors. And it actually supported Obamacare, which makes me crazy. There is, the answer to your question, there is an organization that's like the AMA, it just has a smaller membership. Of course, the AMA only has 17% membership of the US physicians. 83% of us don't belong to the AMA. We belong to the Association of American Physicians and Surgeons. Their whole thesis, their whole plan is something that's directly related to what I say, which is the big problem in healthcare is we need to reconnect the doctor with the patient without a third party in between. And that's another way of what I call market-based medicine, where there isn't a third party decision maker. I didn't say there isn't insurance. You need catastrophic insurance for that disaster that you didn't plan on, an automobile accident, God forbid, or heart attack or whatever, because that's a big ticket item. But for other than that, you can pay for your own care. And that's what the AAPS is advocating. That's what I'm advocating. Get the third party out from the in between the doctor and the patient.
One more time, just so I understand it, and then we'll put it on hold.
Sure.
Who makes it mandatory for the middleman? This federal government or the insurance agency, or it's both? Say it's mandatory for you to, when you make your prescription, for that middleman organization to be involved.
And the answer is the rules that are set up by the federal agencies that the insurance companies have to comply with. So at the end of the day, everything I'm talking about comes from federal legislation and regulation.
All right. Well, all right. Well, there's a new administration, maybe something can change. Tell me some other things that we should know about health. You know, you talked about a family member having a little baby in the house to me and being happy and maybe even helping to make a physical condition lessen the pain and maybe even strengthen the gain. Are there any things that you've seen in your career that you feel us human beings, because we all eventually have some pain here and there as you get older, are there some things you think we can be doing to live a more stress-free, pain-free life?
Sure. Let me start with, there are two things I want to say. One about general people, you, me, and the general public. And the other thing I want to say is I want to talk for a second about children with Down syndrome, trisomy 21. All right. What you and I can do is stop accepting the thesis that we've all been hit over the head with, which is, okay, well, if I eat too much, the doctor will give me a pill and I can get rid of excess weight. Or, sure, I can smoke, but, they got cures for cancer and the doctor can take care of it. The fact is, if we want to be healthy and happy, have to start by saying we are responsible for ourselves and our well-being. And if I am overweight and my joints hurt at 65, maybe I should have thought about this when I was 45 and got into some form of an exercise program in order to keep my joints moving. My point is that it starts with accepting I am in charge of me and I am responsible for me, not my doctor or the government is responsible for me. And I know that sounds sort of philosophical, but it's very basic and important to do that.
Okay, that was one. Now, I think I had another one.
Now, let me give you another one that's a really wonderful example. Doctors today tend to follow, forgive me, cookbook rules, guidelines, clinical algorithms. This is what I do with a diabetic patient. This is what I do with a patient in heart failure, blah, blah, blah. There are a lot of reasons for it, which I can go into if you want, but I don't think it's worth your time. At the end of the day, that's not what we should be doing, we, the doctors. We should be focusing on that one patient right in front of us, what's best for him. Now, let me give you the reality of an example. There was a guy named, I hope is still there, named Joel Brenner in Camden, New Jersey, who is a general practitioner, and he decided to take care of the 36 sickest patients in Camden, New Jersey. He signed them up for his practice. What did he do with them? Well, he did all the usual things in terms of giving him drugs, but he did some other things. Number one, he had his nurses literally take the patients to the pharmacy to make sure that the pharmacist gave them the drug that the doctor wanted, not the generic or what the insurance company said had to be. Number two, they would do home visits at night for those people who had sleep apnea machines to make sure the darn thing was hooked up properly. They would do home visits to make sure the diabetics were taking their insulin and had their A1Cs correct. Okay, is that going too far? Well, let me put it this way. His data showed that he cut costs by 57% by simply doing these extra things. Now, I don't think they're extra. I think that's part of being a doctor. You take care of that patient and what that patient needs. If it's an old person and they're not really sure of what drug to take at what time, you get a nurse to help them, or a helper, it doesn't matter. You get somebody to help them do it. And my point is that we have to take responsibility for the welfare of that patient who has put his or her life in our hands, and not simply follow the rules.
I like it. I like it. I like it. You know, it's another opportunity to be wise and to be, there is no doubt that it's going to pay off, because it's just like if you, I mean, if you have a maid or you have somebody in the house, that's in essence what you hope their responsibility is, to make sure you take it, you know, they help you take your pills at whatever you take it.
And
So
vice
on and so-
versa. And you help them with their meds or their.
Oh yeah, we all help each other if
Exactly.
you have that scenario. If you don't have that scenario, this is by far a wonderful concept of total picture for a patient. And
Well, the question is really simple. Are you simply a technician, physician? Are you simply a technician, or are you a healer?
I hear you. It's your business has gotten. I got a brother-in-law radiologist. He wanted out. He couldn't take the paperwork with the insurance companies.
Oh,
He quit. He couldn't
there
take
is.
it.
I don't think there is a physician in this country who doesn't spend an hour or more a day yelling and screaming and fighting with an insurance company to get a patient what he or she needs. We should not be spending that time fighting. We should have a system that helps us do our jobs.
I hear you. I hear you. Last question. Let me ask you now.
Sure.
We're involved with peace. Think peace. International
Yes.
Day of Peace, September 21st. Dr. Dean, what's peace for you?
Peace for me is, forgive me, the golden rule. Do unto others as you would have them do unto you. If you treat them the way you want to be treated and not make a value judgment that he's a bad person because of a political belief or a religious affiliation or a skin color, excuse me, he's a human being or she's a human being. To me, that's peace.
Okay, my friend. Thank you very much for taking some time and sharing these good thoughts. Congratulations on the book, this very important book. Best of luck.
Thank you.
You
Take
take
care.
care.